Welcome to the Breakthrough Pain Summit 2.0, where we look at approaches to help reduce your pain and increase your vitality and optimize your healing ability. My name is Dagmar Bauer-Fragitano. I'm a licensed acupuncturist and I'm your host. And today I am pleased to have with us a doctor of physical therapy, Dr. Ariele Foster. Welcome, Ariele.
Hi, thanks for having me.
My pleasure. It's great to have you here. So she is a doctor of physical therapy and a yoga teacher and founder of the Yoga Anatomy Academy.com. And she also runs an online yoga anatomy mentorship. And she's the creator of Yoga Journal's 6-week online course, Fascia Release for Yoga. So welcome, Ariele, and tell us, you're a classically trained physical therapist, you practice yoga, and you have become more focused on treatments for fascia. Tell us, how did this all come about? Have you ever been in pain? Now tell us a little bit about your journey.
Yeah, so I started teaching yoga when I was quite young. I was right out of college, and I went down the path of studying Kripalu yoga and Vinyasa yoga. And Kripalu yoga is this very lovely, somatic, organic type of non-dogmatic yoga. At least that was the shape it was taking in the early 2000s, in the late 90s. And then Vinyasa yoga, of course, is structured around the sun salutation and somewhat quick movements, often sometimes with music, sometimes without, but relatively dance-like, aesthetically pleasing forms. And I ended up, after about 5 years of teaching yoga, hurting my shoulder. And when I went to see a physical therapist for that, because I'd already seen a massage therapist and a craniosacral therapist, and I went to see a physical therapist, and I ended up, she ended up knowing what was going on right away. And it was such a huge relief that it was sort of like this intuitive hit, like, that's what I got to do. I've got to go down this path to becoming a physical therapist. And that took me quite a long time, because I was going back in my late 20s, and I had to do all the prerequisites. It was completely a 180 from the other kind of work I had done aside from yoga before. And it was a very difficult decision, a very long path, but it was a great decision.
Very good. Yeah. And so you were hurting your shoulder, and so the relief was instant with the approach this particular physical therapy showed you, or was it already focused on more fascia work?
That physical therapist did deep tissue myofascial release, and it was amazing how quickly it helped me. I mean, I was having a struggle in which I couldn't even lift my arm for a few days, and she did her magic, and it hurt like crazy, which I actually don't always recommend. In this particular circumstance, it was very helpful for me, but within 48 hours, I felt significantly better. So that was my own kind of initial experience with the healing power of myofascial release, and also my initial experience with the healing power of a skilled physical therapist who knows exactly where to target in your body. But I got to say something. So I think that the reason why I ended up hurting my shoulder, one of the reasons, there was almost always there's things are not as black and white as we like them to be. But I was teaching yoga, and I just wasn't strong enough to be able to do all of the chaturangas, all of the up dogs, et cetera, et cetera. So I ended up hurting my shoulder, I think, not necessarily because of sloppy form, but because within the practice of yoga, we have historically ended up giving our teacher, the yoga teacher, just this significant elevation of status and really following along with what they do. Which I got to say, if you go to a yoga class and you don't do what the teacher says, then maybe don't go to class, right? But at the same time, you have to be very, very wise about how we're using our bodies, right? And it's a very difficult kind of conundrum to be in, to be going to kind of a group exercise class and to also maintain your own sovereignty. So we need both. We need that creative, interesting things that we don't know yet, that pushing, but we also need to be able to listen really profoundly to our bodies And even embedded within that, like, you can't just assume that listening to your body is going to take the cake, so to speak, or prevent all injury, because many times our body signals are coming later, like significantly later, 24, 48 hours later. So it's just a tricky situation to be in as a student. I ended up hurting myself because another thing within yoga is that we're giving a lot of credit to these teachers and these lineages. And we've historically been saying things like, oh, well, practice and all is coming. So the more you do, it will heal everything. All of these pains and discomforts that you're getting, they're just kind of toxins leaving the body, or you'll get past it. You weren't doing the yoga right, or you haven't found the right teacher, or you haven't found the right lineage, or you haven't practiced with enough discipline, et cetera, et cetera. That's sort of the self-talk that has gone on historically, I think, in the minds of yogis who've ended up in pain. But the reality is that for many bodyweight exercises, let's just take a push-up, for example, that we don't do very well with progressing it. Like, if I ask 10 out of 10 people on the street how to back off of a push-up using just your body weight, I would say that maybe 2 out of 10, maybe 1 out of 10 would be able to answer that. So for somebody who's really weak in their upper body and you're building strength, just saying like, start doing push-ups and do more push-ups is not going to be helpful. And yet, if you go to a yoga class, an all levels intro yoga class, the reality is that you're going to show up and you're going to be told to basically do a yoga push-up in that way. Downward facing dog, et cetera, et cetera. And if your body's not prepared, there's not a lot of wiggle room within those group classes to be able to progress intelligently. That is why I injured myself.
There you go. And if you were only in pain for a few days with your shoulder, at the same time, you were lucky, because many patients present themselves with long-term pain and stiffness in their shoulder joints very often. So as we go along, and as we have heard a little bit more about your story here, Ariele, for the ones that don't know actually what fascia is, could you please go a little bit more into the detail and explain to the audience, please?
Yeah. So fascia is this incredible system through our body, and the term fascia is in flux probably now more than ever. The history of fascia is that, medically speaking, traditional medical science recognizes fascia like the plantar fascia, which is this dense sheath on the bottom of the feet. And it recognizes the thoracolumbar fascia, for example, in the low back, this, again, a dense sheath. And it is a very narrow definition. Then the movement community has adopted, the movement and kind of cutting edge research community has adopted another definition of fascia. And this definition of fascia, I can actually read you a really gorgeous poetic version of it in just a moment. This definition of fascia is broad, and it encompasses many different parts of the body, as you'll hear. And then there's a third definition well, not a third definition of fascia, so to speak. There's quite a few definitions of fascia, but there's a study that was just publicized recently that there is a new organ recognized in the body, essentially recognizing a new organ. And this organ is part of what has been under the umbrella term of fascia. So I'm going to redo this term. Just know that right now as always, we're in a bit of a flux within research and our understanding of the human body. So let me find it real quick. Okay. So this definition comes from Jill Miller, who is the developer of Yoga Tune-Up and Tune-Up Fitness. She writes, fascia is your living, fibrous, and gelatinous body-wide web. It is a seam system that provides structure, protection, repair, force transmission, and body sense. It is your interconnected soft tissue scaffolding that gives your body form, shape, and felt continuities of motion. Its unique arrangement links other connective tissue structures to one another and thus forms a comprehensive web with biotensional and compressive integrity. Its variable textures interconnect the multiple layers and systems of the body while serving as a highway for tissues to relate to one another, including musculoskeletal, vascular, neurological, lymphatic, visceral, and more. In short, fascia is the body's living, aqueous knitting fabric.
It's a beautiful description.
So gorgeous. It's a little hard to wrap your mind around all of that. So let me just put it another way. Fascia is kind of like the body's scaffolding system. And it's also part of what's kind of absorbing water, hydration, and moving fluid through the body and helping different systems to communicate with one another. So it has mechanical properties of helping to hold us up, create space in the joints. And it also has physiologic properties that are at a very minimum about our immune system and our neurobiology and our hydration. So there is still a lot of research to be done to really comprehend and understand all of the things that it does or doesn't do. But yeah, it is a really fascinating part of the body.
So especially given the fact that it has so much to do with hydration of the body and that the body is mostly water. The importance and value, again, of hydrating the body and the tissues of great importance also. So, so overall, the benefits of a myofascial fascial release, what would you think are?
What do I think what?
The benefits of of myofascial release?
Yeah. Okay, well, this is one of those, I mentioned earlier, humans, we really like black and white answers. And I don't know that there is a black and white answer to this. I think that different healing modalities can be beneficial to different people. But I will say this because I suspect that your audience is people who have some kind of pain or who work with people who are in pain. That myofascial release, especially when you learn how to apply it to yourself, so self-myofascial release, is one of the most empowering, simple, affordable, tremendous tools that we have available to us in terms of addressing pain and discomfort. You can apply it to, for example, just as an example, you could apply self-myofascial release to your abdomen that could then theoretically have benefit to your digestive system, your lymphatic system, swelling in your legs, even to help you to build core strength so that those muscles can contract better. So there's just such tremendous potential within it.
The benefits of it, yeah. And so in order for the fascia to be released, are you mostly working with foam rollers and other props, or are you mostly doing it per se with your yoga poses in this situation?
Yeah. Okay. So that reminds me that I meant to grab like a whole basket of tools so that I could hold them up for the camera, which I completely forgot to do. But in short, you could use foam rollers. You could use lacrosse balls or similar rubber balls. If you were to just search on Amazon for tons of different myofascial release tools, there's a ton of them out there these days that are all really cool. There are those sticks you can buy to roll your legs. And I think you can even do a lot with your hands. So I could show you a little technique right now. If you take the heel of your hand, sort of the pinky side of the hand, and you just drape it across your neck right here, I'm pinning down the skin on my neck at the collarbone. And then I'm going to gently drag the arm this way. Looks a little morbid, so I didn't mean for that to happen, but I'm gently dragging the skin. And then I can actually feel as I do my little head nods, which I'm calling my Stevie Wonders, as I do these little movements with my head, I've got the movement happening beneath a layer of skin. And that's helping my arm to very slowly, I don't know, it's not moving very fast, so it's not much to see here. But you can see that my hand is in a different position than it was originally. And so that's a form of self-myofascial release that uses no tools. None of this, so you could self-myofascial release everywhere from your scalp to the area around your toenail, you know, but I think that it has to be for our long-term health. It's really, really powerful for eliminating day-to-day pain, eliminating acute pain from like an injury. It's really powerful for diminishing chronic pain, but it's also has to be paired with motion and strength building. There's just no way around it. So our bodies really need intelligent strength building. And it's tricky to know what to do always.
Absolutely. And so, some people have more strengths and some people have more of a hypermobility than others. Could you explain that a little bit, how that may relate to treatments of the fascia or just in general to pain also?
Great question. Yeah. So I think that if you are hypermobile, it doesn't necessarily mean you're not strong. You can be an incredibly strong hypermobile human being. Hypermobility, hyper means above average or more than average. And so it just means you have more laxity in your joints, so that your baseline, like let's say 3 people just lay in bed for 3 weeks and do nothing else. God forbid that happens. But you take these 3 people and one person is going to have the hardest time touching their toes and getting their shoes on and off afterwards. And one person is going to have, is going to be able to fold forward and put their palms flat to the floor without bending their knees. If we were to look at the spectrum of human nature, and the other person will be in the middle. So a hypermobile person has this laxity in their joints that gives them perhaps some advantages, but also some disadvantages. So when you have that excess mobility in your joints, you actually can get more wear and tear. There are studies that show hypermobility, like baseline hypermobility, is linked with even increased anxiety levels, increased risk of osteoarthritis, which is the typical common arthritis that we hear about, the old folks arthritis. And it's just correlated with certain injuries especially around the hip, which is really vital because you may not only have like loose collagen structure, which is what makes the joints loose, but you may also have, if that's coupled with like a shallow hip socket, then you could have a predisposition to pretty major arthritic changes in your hip over time.
I see. So especially as we go more into middle-aged or like the baby boomer generation also, where possibly some of those issues flare up a little bit more than in the younger years also. So what would your recommendation would be possibly doing a little bit of self-fascia release on a regular basis also? And what would you recommend for the elderly in that case?
So let's talk 2 different things. So 1, who and when to do self-myofascial release. And then 2, I'm going to take a body part and kind of break it down and talk about what you would do if you have pain in that body part. Okay, so who does self-myofascial release? When you are practicing self-myofascial release, you can do it daily. The things to look out for would be things like bruising. You don't want to bruise yourself. You don't want to cause so much redness that there's breakage of the capillaries, and you don't want to cause yourself more pain. So that, for example, I've seen people using foam rollers in the gym where they're like gritting their teeth because they're like, oh, this hurts so much. And they're just kind of plowing through their bodies without really being soft and kind of like practicing that what our bodies truly need. So, which is, to put it another way, you can practice self-myofascial release in a way that calms your nervous system rather than a way that aggravates your nervous system. So that would be my recommendation. Now, when you are elderly, and this is going to happen to the best among us, so one of the things that happens is our skin thins out as we age. So you're actually more vulnerable to the kind of shearing breakages in your skin from shearing actions, which is when something is kind of rolling over something else like that. And so when it comes to somebody over, say, age 75 or maybe over age 70, I'm going to be much more careful whether it's using my hands or teaching self-myofascial release. I'm going to be much more careful, and I'm always going to err on the side of a softer foam roller or a softer ball. And
especially when, excuse me to interrupt you, if they're on blood thinners.
Oh, thank you for saying that. Yeah, if you use blood thinners, you're absolutely going to be much more at risk of internal bleeding. But to put it simply, it's very unlikely that you would get internal bleeding from meaning like organ bleeding from self-myofascial release, but you would definitely be much more susceptible to bruising. And you probably know that without doing self-myofascial release. So self-myofascial release may not be something you want to do, or it may be something you want to approach very, very lightly, like using a rolled up towel roll with duct tape rather than a foam roll or something like that. Mm-hmm. So that's kind of the who and the what. And then let's take, for example, somebody who's having pain in their hip. Mm-hmm. And if you have pain in your hip, you can use self-myofascial release as part of your pain management strategy. So what I might recommend to a patient who has pain in the hip, and this is not medical advice to anyone in particular, so please don't interpret it that way, but what I might recommend would be a combination of maybe 2 minutes daily of rolling out on some ball. And the larger the ball, the less intense the pressure. So if somebody was in a significant amount of pain and had a significant amount of like tissue tightness, I would just recommend a larger ball or a softer ball or a softer, larger ball. And you can, if somebody is like a young athlete and they don't have they have good tone, but not excess tone, then I could recommend like a lacrosse ball or something like that. So that would be about 2 minutes a day. And then once you did that, one of the benefits of self-myofascial release or myofascial release in general is that you end up getting better mobility in the near term afterwards. And so you could then use that new mobility to strengthen in a new range. So if it were hip, you might follow up by strengthening glutes, doing things like clamshells, doing like hamstring strengthening, the things that most of us need. And especially because I work with a lot of yoga people, we actually don't get enough glute or hamstring, inner thigh or outer thigh strengthening. So the strengthening component just has to be a part of it. And then function, I think, also has to be a part of it. So I can give you all the wacky, like different floor exercises possible, but at the end of the day, I need you to be able to stand on one foot and not fall over, and use your glutes in the way you walk, and use your glutes in the way you sit and stand and squat and get up. So I would develop a system like that for somebody who has pain in a specific area of the body. You could apply that to the back too. The one thing I'd say about self-myofascial release to your low back is don't get on the bones. It's just not worth it, because they're supposed to have a fair bit of mobility, and you can end up creating a hypermobility, like actually instigating hypermobility in your low back if you were to be aggressive with self-myofascial release there. So don't use the foam roller like side to side on your low back.
That's great advice. Yeah. And so then you, maybe we would recommend probably to see a physical therapist who gives you some very skilled exercises. Yes. Along with possible the myofascial release also. And then as you progress of the number of treatments or so, to also be instructed for some home instructions later on. What is your treatment recommendations, Dr. Ariele?
Okay, well, definitely I think that everybody needs, if you're in pain, go see a physical therapist. Don't try and do it all on your own. And I know I'm totally, completely biased in saying physical therapy. There are other great healing modalities out there too. But what I like about physical therapy as a profession is that we are very much about empowering you. So we're not like putting needles in you and then saying, okay, come back next week. There are physical therapists who might do that, but we are creating more comprehensive plans. We're looking at managing your pain, getting it down. Some will ask about hydration and diet, and I really recommend you examine that for your pain. And then they'll develop with you a home program. And so going to physical therapy is like a way of really self-empowerment, meaning it might be self-myofascial release, it might be exercises, as I mentioned earlier, but they're things that you can do on your own, that slowly you can wean yourself off of it. But we all, myself included, we need teams to help us. I also recommend really creating your own tracking system for building strength, whether you do it like the way somebody who goes to the gym marks off the number of repetitions and weights that they're doing, something like that to help track and build your capacity so that you remember how far you've gone. I had a briefly a client who just a year and a half ago had the hardest time getting on and off the floor. And she's been completely inconsistent in her practices and completely inconsistent in her exercises. But every time I've seen her, which is, let's say, 25, 30 times over the course of a year and a half, this is a private client. She's not a physical therapy patient. So I'm not even doing hands-on stuff with her, but we're just working on her toe mobility and her squatting and some other yoga poses. And she's getting on and off the floor so easily now, and she doesn't even remember how hard it was. She thinks, oh, I'm so klutzy, I can't do this in a beautiful way. And it's like, you couldn't do this at all a year ago. So remember to track, because it's really, really part of that empowerment process. And finally, motion is lotion. So the more you move, the better things will be. I think we get scared to move when we have pain. I'm not saying to move in a painful zone, but to make sure that you're still standing up as long as you can, that you're still experimenting with new exercises, that you're still trying new things. I actually have a whole YouTube of gentle yoga classes that you can check out. If you just Google my name, Dr. Ariele, Ariele Foster, that YouTube channel has a ton of really gentle yoga classes that you can follow along with.
That's wonderful. Very good advice and such valuable information. And our time is passing by quickly here. So before we have to sign up, let me refer the audience to the free gift you're offering to them, which is a healthy hip yoga and self-myofascial release practice. And it is a video of yoga and self-myofascial release techniques for hip care. So thank you so much for your generosity, Dr. Ariele. I'm sure the audience will appreciate it and check it out, and hopefully everybody can make this to good use for their well-being, and it will serve as an empowerment tool towards their health. And for you, thank you so much for your presence today and for your insightful information. Really appreciate you taking the time. And to the audience, thank you so much for listening. I hope you enjoyed today's interview with Dr. Ariele Foster. And please go ahead. The link will be posted also, or you will find it in your inbox. And I look forward to welcoming you back again tomorrow. You will find all the necessary information in your link in the inbox to the next session of the Breakthrough Pain Summit 2.0, where we look at approaches to reduce your pain, increase your vitality, and optimize your healing ability. Thank you so much and have a great day.
Thank you, Dagmar.